Hello, I'm Dr. Diarra Houleymata, the CEO, the Chief of Party of USAID Integrated Health Program in Democratic Republic of Congo. The Democratic Republic of Congo is one of the unhealthiest places to live. In the southeastern corner of the country where we are working, our provinces are near the bottom of the world rankings. Some of our villages are reachable for the provincial capitals only by 2 weeks in the gym, and stock out of vital medicines is commonly shockingly common in our areas. It's not a part of the world where you would expect local data ownership to be much a priority, not to mention a strategy for community to improve their own health. But my project is seeing results in malaria reduction, case reduction, and supply chain management. Thanks in our part to push the data in the hand of people who are most affected by following digital development principles. I'll start with malaria. The national government of Congo set up a 5-year national target for reducing malaria cases, but most communities are unaware of this information. So the question becomes for us, what can we do exactly to hit this target and how we can track their progress? Our program developed a strategy that includes a data tracking system for nurses and community engagement plan. Nurses are the key point of contact. They meet monthly with local providers to collect data in their health area. Nurses are also monthly working with community health workers to share key messages and which interventions are working. The community health worker then visits families to see how they were adopting key behavior and report back to the neighboring falling short. The nurses then hold open doors for the until communities. They present the malaria case against local and national data and respond to questions. Community reaction has been striking. People have told us that they've seen the data help them understand the direct connection between their behavior, especially using mosquito nets and malaria cases. One powerful data was the indirect cause of malaria. Families were surprised but acknowledged the link between a sick family member and the cost due to the loss of time working and transport costs to the hospital. This creates more interest. For example, during antenatal care visit, a pregnant woman coming to the health center really requested the prophylaxis. If it's not there, she scaled up to the chief medical officer to get the sets. We also apply local data ownership to close supply chain gaps. We train hundreds of data managers, stock managers, pharmacists to populate InfoMed, which is the government online tracking platform for medicine. Last year, we started training the pharmacists to plan and budget using InfoMed and managing balanced stock themselves. And this report stock out was steadily declined from an average of 70% to 45.7% between January and March 2021. I'll be honest, we didn't set up to model digital development principle, but then we saw it's aligned with most of them. We work within the ecosystem, existing ecosystem, design the scale, build for sustainability, and introduce data to drive community demand and calibrate health outreach. The core digital development is local, but putting data under local ownership and in the hand of people who are most effective, helping them find a solution. Thank you.